And we're live.
Good evening. I am Barbara Askins, President and CEO of the 125th Street Business Improvement District. Welcome to our COVID Watcher educational series. COVID Watcher is a research, advocacy, and policy platform developed by Columbia University in partnership with New York City community partners. The 125th Street Business Improvement District is a community partner, and one of our roles involve working with the university to encourage businesses, residents, community organizations, and government to participate in the COVID Watcher project by responding to surveys that will yield responses that can help identify and prioritize the next steps for a safe New York. It has been well documented and accepted that Harlem is one of the hardest hit communities by the COVID-19 virus. There is also talk about a second wave. How does a community that suffered great losses survive and ultimately prepare in case there is a second hit? Surveys alone are not enough to obtain engagement, effective engagement from the community, nor will it get answers to some of the questions that are being asked. The success will depend on the community that is working together. The COVID Watcher educational series is designed to facilitate discussions between the many different members of the community, to hear from those members about the impacts and their personal experiences, to obtain a greater understanding of what happened to us, and hopefully learn how to prepare for any future impacts. The 125th Street bid is a business district that is Harlem's main shopping district, and it is located in a historical community with many assets. Basically, everything on and around 125th Street affects this commercial district. Thus, it is important as we look at the impact of COVID-19 on our business community that we also examine the impacts to those connections and relationships that complete us. Located within several blocks, both north, south, and directly on 125th Street, are many housing developments that were severely impacted by COVID-19. These developments are the homes to important members of our community. So it is only appropriate that we launch this series focusing on the impacts that they have experienced. The topic for our first educational series is Who's at Risk? Understanding COVID-19's impact on low-income communities. Our moderator is Esther Fuchs. She is Professor of International and Public Affairs and Political Science and is the Director of the Urban and Social Policy Program at Columbia University's School of International and Public Affairs. She is also a member of the Board of Directors of the 125th Street Business Improvement District. I give you Esther Fuchs.
Start again. Thanks so much, Barbara. And thanks so much for everything that you do for New York City and the Harlem community. And we are so fortunate to be working with you on the COVID Watcher project and any number of other projects. Before I get right into our town hall today, I just want to remind everybody that this is a live event and you can submit questions via YouTube throughout the event. And I also want to thank those of you who submitted questions in advance of our town meeting. I've got those ready to ask our panelists. Tonight's virtual town hall is being hosted by Columbia University's COVID Watcher project, as Barbara mentioned. Please go to the website or download the app and take the survey. We are also being sponsored by the School of International and Public Affairs and the Medical School and the Office of Community Affairs at Columbia. It's a lot of Columbia, I know. But we are delighted to be partnering with the New York City Comptroller Scott Stringer, with Community Voices Heard and the 125th Street Business Improvement District. And as Barbara mentioned, our topic tonight is Who's at Risk? Understanding COVID-19's impact on low-income communities. And we'll specifically be focusing on the economic and health effects of COVID-19 in high-density, low-income housing populations with a particular emphasis on NYCHA. And as Barbara said, you know, why are we focusing on this community? Because all of you know from your own experiences, and we also know from the data, that our neighbors who live in public housing have been hardest hit by the pandemic. And so tonight we've put together what I think is an exceptional group of panelists who will not only help us understand what's going on, but also help us understand what we can do to keep safe and healthy and what government can do to ensure that we have economically viable communities as the city reopens. Because we want to be safe and healthy, but we also want to be able to have jobs, and we want to have an economy functioning in New York City as we move out of the COVID pandemic. So let me briefly introduce our panelists. And forgive me if this takes a little too long. I have shortened everybody's bios as much as I possibly could have, but this is really, as I said, quite an extraordinary group. Well, first, it's my personal pleasure to introduce our New York City Comptroller, Scott Stringer. Just a little bit about Comptroller Stringer. He's been serving in the Office of Comptroller since 2013. Some of you may know that he was also born and raised in Washington Heights. I consider that important information, given what we have to deal with today. He served in the State Assembly representing Manhattan's West Side for 13 years, and he was also Manhattan Borough President. He's an exemplar of public service at its best. And some of you may not know just exactly what a controller does. Well, I guess you know he safeguards the city's money. And if that weren't enough, Comptroller Stringer has also been holding this mayor's feet to the fire on every important issue that we care about. And he's focused on New York City's affordable housing crisis and actually audited the Housing Authority, which I don't think any other controller did, and forced, as a consequence of his audits, repairs and improvements to the quality of public housing. More about this later. I'd also like to introduce Delvette Castor, who is Director of Health Services Delivery Sciences Section of the Division of Infectious Diseases and Assistant Professor of Medicine at Columbia University's Medical Center. Delvette, that is a big title, but it's a big job that you have. Dr. Delvette Castor earned her PhD in infectious disease epidemiology at Columbia University. She's worked extensively in HIV prevention, care, and treatment, focusing on risk factors for HIV in low and middle income communities. And for the last 10 years, she's also managed and provided technical direction for USAID in both the research and implementation activities. And she has focused much of her work on high-risk communities. And I'm so happy she agreed to be part of our panel discussion today. And Jason Zucker, who I've worked with before, who's part of our COVID Watcher team, is an instructor in medicine in the Division of Infectious Diseases at Columbia University as well. And Dr. Zucker is an instructor in medicine and also in the Division of Infectious Diseases and adult and pediatric infectious diseases. His clinical and research interests surround sexual health and improving prevention and treatment for adolescents and young adults living with or at risk of HIV and sexually transmitted infections. Since the start of COVID-19 pandemic, his work has shifted focuses to really understanding the outcomes and impacts of COVID-19 on communities and household transmission in both adult and pediatric patients. And just to say one more thing about my medical school colleagues, they've gotten involved in this work pro bono and they're doing amazing things. And I just feel very fortunate to have had the opportunity to work with them on the COVID Watcher project. We also have with us Carlton Davis, who's the president of Grand Houses Tenant Association. Carlton provided the shortest bio, which of course usually means he's the most interesting person we have on the panel. Carlton is the president of Grand Houses Tenant Association. He previously served in the federal government and the military for the Navy Recruiting Command, Code 30. He was an assistant head of recruiting, manuals, plans, and policies. Carlton also is a former Golden Gloves boxer, DJ, and MC. I think that probably says it all. And finally, we're really delighted to have with us Afia Atamensa, who's the Executive Director of Community Voices Heard. Afia had joined Community Voices Heard team in September of 2016 as the Executive Director. Before that, she served on the board. She's worked in Ghana, West Africa, in the urban centers across America, and she's worked to improve the quality and quantity of fair and equitable housing, defend racial and social justice initiatives, and galvanize support for programs benefiting low-income families. She was awarded a Fulbright Fellowship in support of her work, and she has a law degree from Fordham University and a BA from Trinity College. And I just have to say that Afia has really taken Community Voices Heard work to another level, which is to say, I think its impact is stronger, its activity has been more effective, and truly she is really representing the community when in this conversation where we really want community interests represented. Thank you all for being here with us. I know we have lots of questions and an anxious group who wants to hear what you have to say. And I think a group who's stuck inside this evening because of the rain out there. So hopefully we will provide them with what they came to hear. So my first question is going to go to the controller. And this is a difficult question, controller. So many of the impacts of COVID for low-income families, especially those in NYCHA, relate to poor housing conditions. A lot of people don't actually know that. And as controller, you don't actually make policy. Some people may or may not know that, but hope they know that now. But you've chosen not to just point out problems through your audits, which is part of what you're mandated to do, but actually to propose solutions. And so I really want to know, and I know that those people who've signed up today for this town meeting also want to know, what have you found were the pre-existing problems in public housing that have made it worse for people who live there in dealing with the pandemic? And then, of course, I'd like you to talk about what you think the city should be doing to address these problems. So again, the problem, but also what can we do?
Sure. And well, first of all, Esther, I'm really honored and privileged to be with all of you tonight. I'm really excited to join with this incredible panel. And I guess the best place for me to start this important conversation is to talk about where we are, how we got here, and how we're going to rebuild, because there's no denying it. We are facing one of the most trying times in our city's history. The COVID pandemic ripped through our communities with unrelenting, devastating force. We lost lives and livelihoods. We lost parents and grandparents, friends, loved ones. Our economy spiraled and our small businesses shuttered. And now New York City's unemployment rate climbed to an unprecedented 20.4%. And while the fallout of COVID-19 impacted everyone in our city, the right to basic health, safety, and economic security too often was tied to the color of your skin and your zip code. And my office analyzed which communities were hit hardest by the virus, and what we found was heartbreaking, but to many, this was not surprising. People of color, seniors, and low-income New Yorkers, people living in NYCHA and overcrowded and dilapidated housing, single-parent and immigrant households. These are the communities that not only suffered the brunt of the virus, but the economic consequences too. Black and brown New Yorkers died in far greater numbers during the darkest days of the pandemic. And today, 1 out of 4 workers of color is unemployed. But here's the truth that we have to come to terms with. We failed these communities a long time ago, and we left them vulnerable long before COVID hit New York City, because our long-term divestment in housing, in healthcare, and food security, and environmental quality was very much a long-term agenda strategy. And the very same New Yorkers who were most at risk during the pandemic were the ones who were putting their lives on the line to keep our city running. The essential frontline workers with families. These are folks in healthcare, transit, EMS, childcare, grocery sanitation, and more. And so we in our office started looking at the numbers and analyzed who these heroes actually are. And we found that most frontline workers are women and people of color, their parents, and they're living below the poverty line. So hear this, who are the heroes? The heroes are actually the most vulnerable people in the city. And they're the ones who were ignored, they're the ones underpaid, and they're the ones overworked. So to get into the housing aspect of this, the first thing we have to lay bare is that the systemic inequalities that run through our city, this longstanding cycle of disparity, this is the culmination of what happens when you underserve and overexpose communities of color. So when we now talk about reopening and recovery, how we rebuild, we should not build back the way we closed, because that wasn't working. We should not build back to the status quo that left most of our neighbors vulnerable. We have an opportunity to break that cycle. We can do this differently. We can actually create real strategies to center and lift people up, the people who have always been most in need. So to get to your question about how we focus on NYCHA and housing, let me start quickly with a couple of basic points. We have got to refocus our previous resources towards building permanent, truly affordable housing for low-income and very low-income New Yorkers. And it's important to use the word low-income and very low-income, because affordable has taken on much a different conversation. This pandemic has reinforced again that many New Yorkers are only one paycheck away from losing their homes, and they're living in overcrowded conditions, which has exacerbated the COVID crisis. So we proposed a plan called Universal Affordable Housing. We have got to look at every new site of development in New York, and we should set aside 25% of units for permanent low-income housing, whether it's as of right development or under ULURP. We need to build housing that's actually affordable for the people who need it the most, the sales clerks, the home care, health aides, the taxi drivers, and the cooks. And that is a housing plan that is much different than de Blasio plan, which focused on basically giving the house away to the gentrifying Midtown developers. It's time to change that scenario. And we also have to reverse the decade of divestment in NYCHA. 400,000 people live in NYCHA. It's a city as large as Boston. But at the end of the day, we are not going building by building, making the repairs, using the management tools to truly bring NYCHA back to life. Yes, there's a federal component to financing. Yes, we're in a pandemic. But when we get that housing stimulus money, if we do not have a plan to help the people in NYCHA, we will create a permanent underclass that we will never get out of, and NYCHA will literally collapse. So these are some of the ideas that we're thinking about. Add on childcare, add on incentives for small businesses. And I do think we can build our city differently for more people and to create a fair city. But to do that, it starts with housing. I agree with you. It starts with NYCHA. It starts with a new low-income affordable housing plan. And it starts with this notion that we cannot think only in terms of Wall Street survival. We actually have to start thinking about our communities, because Wall Street's just going to be fine after the stimulus money and after all this works out. The wealthiest people tend to do the best. The poorest people continue to struggle. I think we can change that for our city.
Thank you, Comptroller. Afia, I really want to ask you the next question as a follow-up. Do you think this assessment is correct? And is it consistent with the recent report that Community Voices Heard released addressing conditions in NYCHA and the physical and mental well-being of the NYCHA residents?
So thank you for the question. Let me first thank Columbia University and all the partners from tonight, like the 125th Street Bid and so many others. And I'm just so excited to be part of such an esteemed panel. And so I'd say, you know, as usual, I'm in full agreement with the comptroller. You know, in our report, what we did was highlight things that residents of NYCHA has been saying for years, right? Lifting up the conditions in the household and in some of the common areas that's way too many residents in public housing are forced to live with. But made the connection about this being a larger public health issue, right? This was pre-COVID. That shocker, if you know you have mold in your household, you more likely to then struggle with issues of asthma. And so now that we're in the midst of this COVID pandemic, to the comptroller's point, what this pandemic has done is laid bare to communities, I would say outside of communities of color, just how deep the disparate treatment and impact are of both low income communities and frankly, Black, immigrant, and Latinx communities across New York City. And so I think there has to really be a moment of reckoning both as a nation as we grapple with this, but for New York City, where we see ourselves as one of the greatest cities in the world, right? I'm blessed to live in the People's Republic of Harlem and know what Harlem means both here and abroad. And would say this is really a time for us to have an introspection, right? To think about how we want to be as a city. To the comptroller's point, when we think about what New York City will be post-COVID, at Community Voices Heard, we have been adamant about pushing for an equitable post-COVID recovery. So many of my membership, so many of my neighbors, so many of my family were catching hell before COVID, right? And so while it has gotten astronomically worse, we can't look past the fact that the vast majority of us were living in substandard housing, both in public housing and in the private market. So many of CVH members and New York City residents generally were doubled and tripled up, or paying 60 to 70% of their income towards rent, right, in non-sustainable situations, underemployed, in a segregated, right, an apartheid school system, facing an apartheid court system. So how do we use this crisis moment to leverage a better future for New York City? And our piece at Community Voices Heard is that it has to be more than a performative conversation with people. It's gotta be an in-depth, shoulder-to-shoulder planning, centering communities of color, centering Black communities, frankly, centering women who have grown, particularly throughout COVID, have been a key part of essential workers doing the work to keep the city going, taking care of our sick. You know, prior to us starting, I had my 20-month-old on my lap, and I was commenting that I'm bribing my 7-year-old with Doritos and copious amounts of iPad. There's so many of us who are just trying to cobble a moment of peace and sanity together as we try and figure out how to make a little something for our families in this moment of turmoil. And so many people are facing that. And what's, I guess, an insult to further injury is they're facing this with the city of New York being their landlord, right? With the New York City Housing Authority, who, you know, and we've been clear critics of this, de Blasio administration and their mishandling of public housing. But to be intellectually honest, public housing has been disinvested for more than 3 decades, right? But in this moment, we think it's particularly telling that we have clear public health guidance from scientists and doctors about social distancing. Well, I would submit to people that for a lot of residents who live in public housing, high-story buildings, it's difficult to social distance when you're waiting on an elevator that was lackluster pre-pandemic. I know the comptroller's office and many others have lifted up the issues with the elevators. There have been New York Times articles about it. So if you live on the 24th floor and you're waiting for that elevator to come, do you risk it with the other person in the elevator, knowing it might be, who knows how long until the next one comes if you have to catch a shift, right? If you have to get where you have to get. So I'd say that what has made this particularly difficult is a lot of, we say that Black and brown communities are not just vulnerable, but they've been targeted, right, with pre-existing health conditions. The CVH headquarters in New York City is in East Harlem, where Black and Latinx kids have some of the highest asthma rates. It's not because our lungs are weaker, right? It's because we are near waste development. We are near these highways that have targeted us and left us with some pre-existing conditions that are only made worse by COVID. I lifted up the issue of mold in public housing. Again, things that make people with precondition that is then exacerbated by the issue of COVID. And we know with the inequalities in New York City, but in, across this nation of ours, that it's majority Black and Latinx and immigrant women who are the essential workers, right? Who are doing that vital work that keeps so many people alive. Elder care, when we think about the crisis of COVID in the nursery centers, the nursing homes. Well, who were the workers in those nursing homes? Right. And so these are some of the same exemplary salt of the earth men and women who are then having to go back home to the same communities where they're doubled and tripled up through no fault of their own because the rent is too darn high, right? Who are unable to socially distance in developments where things are packed on top of each other. And if you need to get upstairs, you got to take that risk in the elevator. So there's an opportunity here to reimagine the city, not in some utopian idea, but with a clear ideology that there's got to be equity in the city, right? And how do we use this crisis moment to both push people to big, bolder ideas? We like to say we use these opportunities to move people to their better angels. And there's some plans here that I think folks can come together on to say that this is in our self-interest as individuals, it's in our self-interest as a city, and it's now a public health necessity. The housing crisis of affordability in New York City is nothing new. We say it's a public health issue when you have folks who are homeless, right? And as we know, even with the eviction moratorium, there are thousands of people in New York City who have lost their job, who are scared of heck every time the first of the month comes because they know it's yet another month of rent that they can't pay. So what happens after that eviction moratorium? Well, we have more homeless families, which further exacerbates this crisis of COVID. So, I don't want to be a negative Nancy because I know there's a pathway here and a vision forward and steps that we can take. And I'm so excited about this opportunity to talk about it because I think this is the time that we have to kind of stand shoulder to shoulder as fellow New Yorkers and say that we can come through this, but we got to come through this stronger and bring everybody along with us.
Thank you, Afia. And I think it's very important that you and the controller are laying out the issue the way you have and talking about that it's not really coming in a vacuum, that there is a linkage between the conditions that existed before COVID for a lot of these high-risk populations that are Black and brown and are living in public housing. And so we're really fortunate to have Carlton here with us, who is the public president of the Resident Association of Grand Houses. And Carlton, I'm wondering if you could just tell us from your experience about how COVID-19 is actually affecting people in the Grand Houses, which is my neighborhood and the neighborhood of Columbia University. I know you're there.
Yes,
Good.
Can you hear me?
Yes, now I can hear you.
We're
Great.
going through a gradual change. Our residents are receiving all the cleaning elements of hand sanitizers. We give out masks, thousands of masks. The city comptroller, Scott Stringer, Nina Saxon, they came in and gave us additional support. Right now, we got the report from Nolan Hicks from the New York Post. We was at 22 deaths, 16 were confirmed and 6 were probable, 127 cases. We was the highest in all of the developments, bar none. Right now we don't have the stats, but we are cleaning up grant. The whole presidency was based on a cleaner and healthier environment. We have the property managers, they are on the same page. NYCHA overheads, they are also on the same page with Miss Octavia Haywood and Miss Gadsden. And we've been doing a cleanup in Grant. Grant is cleaner. People are spraying down their own mailboxes. We're showering down the stairwells. We need more of that to be visible. And we're trying to knock down, the deficit of people passing away from a virus that's based on just your health and being clean in your area. You know, we all know now there's a traveler's disease. You know, people travel and you acquire this disease from them, like, you know, a common cold. But this is real bad. And we're in grant houses. We are letting people know what we're doing, and we're expanding out that all of NYCHA should do or have a day of washing down their stairwells and mopping and cleaning. We need a full effort. There's too many people in housing where this cannot be done. We've been trying to do it. We need to do it now as we going into a second wave of flu season that is coming upon us. This is very serious. I think we really, excuse me, I think a little emotion there because we lost a lot of people, a lot of them I knew. But yeah, we need a massive cleanup. Right now, we're doing food deliveries for all those that are homebound with Fresh Direct. We have other agencies like Share for Life. They all coming in, and we're getting food to the elders. We're checking on them. We go door to door, and we clean as we get up there. We spray and wiping down as we get on any apartment we come to. We spray and everything. And I think other housing developments should do the same thing. I think we have the ability to knock down the level of coronavirus that can.
Carlton, if people want to volunteer, is there a way for them to reach out? I just thought I would ask that right now before we move forward with the rest of our conversation.
Yes, right now, like I said, we have the Emergency Delivery Committee. We have an offshoot committee team known as COVID-19 VRN that's coming through NYCHA. That's the Volunteer Response Network. We have formulated 16 members, and we do have volunteers, and they all we are going at it. Going at it right.
It's just so important, everything that you're saying, and it can't help but worry that we're not doing what we need to do now, and that the possibility of a second wave is very clearly in front of us. So I want to ask Jason and Delvette 2 questions. I'll first ask Delvette, is transmission of the virus more likely in the conditions that Carlton and Afia and the controller have talked about? And Jason, can you tell us more about efforts that are going on to control the further spread of COVID-19 and to deal with this possible second wave? So I'll start with Delvette.
Sure. Thank you, Esther, and thank you so much for inviting me to participate in this discussion this evening. It's a wonderful experience. I'll say I'm also a Harlem resident, so so I'm not just presenting from Columbia. And in fact, right now I'm looking at MLK housing outside of my window. So I'm contiguous also to a NYCHA housing. And I will say I'm speaking both as an epidemiologist and as an Harlemite and a longtime Harlemite. I say Harlem Village because it is so much a village. The person you find on 115 Fudidjo here is also selling something on MLK. And so to Carlton's point, there's a lot of migration that happens within Harlem, and it's not that NYCHA is contained, right? It's I mean, there's a lot that we understand. And I would say initially, when we started seeing what was happening with this epidemic, we were looking at the outcome, the disease and the mortality. And there was certainly a skew to thinking about why are poor people getting sick and dying? And it wasn't as clearly tied, I think, to the average person about what it meant about transmission, because we hadn't really characterized all the things that we now understand about transmission, about whether or not you're symptomatic, and how you can transmit irrespective of whether you're presenting disease, the idea that you had to travel from far away when it was already here, and then you certainly, all of the things that Carlton and Afia talked about and Scott spoke about with the housing conditions would mitigate transmission. If you have a lot of people together, that for sure increases your the risk of transmitting from one person to the next. All of the things that are in common messages we know. We often do an exercise, I would say prior to COVID, both Jason and I function in our normal lives as HIV researchers. And as you mentioned, in my normal life, I also do a lot of work in sub-Saharan Africa and in other places where we try to make the message about how transmission happen specific to the way the people live their lives. And I know many of you have seen the paintball exercise where you say, well, this is how disease gets transmitted. And you start with the blue spot paint and you sort of go from person to person. And we use it often when we talk about sexual transmission. And the same is true for COVID, right? So, I mean, the person who I was fighting with, and I'm telling you an honest story, I was fighting with to make sure that everyone in the salon had a mask when I braided my hair so that we could get this done, was also mask free after we had a long discussion. So there was reiteration like, okay, you've had an exposure here, you go there. If you don't know that you're necessarily uninfected, the mask is very important so that you don't transmit it to another person. It's about conscientious prevention. So it's not just that the mask prevents me from getting it from someone else, but I'm being conscientious to my community and my village. And I think the story of NYCHA is just a microcosm of what we see in the entire contiguous areas and in all the areas in New York where it's the same kind of people who are living there and just the dynamic within the community. So that's a long-winded answer to say yes. The conditions, certainly with the density, the sanitation issues, I think the lack of clarity of guidance, if I'm to be painfully honest, I can, you know, if I could take a picture of the park right next door, there's almost no guidance to the patrons to remind them. Their grandmothers and grandkids and different people interacting at the same time. And still there's not a common practice of sanitizing the space that is constantly being utilized. So I think all of those are factors that will increase transmission if there is virus around.
That is extremely helpful. And it's kind of mind-boggling to me that in the parks, there's not enough simple signage at this point to help people understand transmission. Jason, could you pick up on where Delvette ended and talk about some of the misconceptions about COVID-19 and what are we looking like for the possible next wave?
So thank you again. Thank you very much for having me. Obviously, it's very challenging to follow Delvette because that was a wonderful response.
I know you can. I've done this with you before.
And I will. So I think, you know, a lot of the misconceptions around COVID-19 are not as much misconceptions as they started as a lack of knowledge. You know, when this first happened, we were very focused on hand hygiene and less focused on sort of airborne or respiratory transmission. We now know that wearing masks are a much bigger part, even though initially we didn't think that wearing masks were going to be very helpful. We know a lot more about sort of who it affects and how it affects people than we did before. And I think some of those things have really allowed us to do things like social distancing, mask wearing, and other things to reduce the spread and make sure that New York City, in spite of being incredibly dense, has the lowest positivity, one of the lowest positivity rates in the country right now, which is really a testament to sort of the work that's been done here and the people really going along with it. It's also really been support for sort of outdoor dining. I know they made an announcement today about the possibility of outdoor schooling as well. Any activities that you can do that are outdoors are going to be lower risk than indoors now that we understand transmission risk better, providing adequate ventilation and things like that. So I think we know a lot more than we did before. When it comes to the second wave, it's going to be more challenging. You know, again, we don't yet know enough about immunity. The first reported case of somebody being reinfected happened the other day. It was about 4 months post-infection. We know that there's probably some immunity from coronavirus when you're first infected, but how durable that is, how long that will last, and how long that will protect you is still unclear at this point in time, keeping in mind that we've only known about this virus now for less than a year. So we don't have data for any further than that. You know, when the second wave comes, it's going to be wintertime. That's going to make it more challenging to do outdoors things. You know, the restaurants have been able to focus on outdoor dining for now. We've talked about outdoor schooling. Come the dead of winter, we're not going to be able, in spite of heaters and other things, to have outdoor dining and outdoor outdoor schools or anything really outdoor. And so sort of figuring out how we're going to manage keeping people socially distant in indoor settings is going to be important. A lot of the lessons we learned about working from home and who can work from home and how to work from home, if possible, are going to be really important in this next wave, because it's not going to be as easy to do things outdoors. I think some of those things are the things we need to keep in mind as we prepare.
Well, so I just want to follow up quickly with both Jason and Delvette on these health effects, because as we go into the other impacts of COVID, which are, really destroying our lives in many ways, we actually do need to understand the health effects and what we can do. We're not going to be able to reopen our economy or get our kids back to school if we don't focus seriously on these health issues. So I have to ask both of you two, a difficult question.
Mm-hmm.
And I'll ask one to, the first one to Jason and the second one to Delvette. The first one is really on kids going back to school. The mayor announced this hybrid plan for getting kids back to school. What about the risks for school-age children and their families? Is this a viable, I mean, you can answer this any way you want, but I know you have deep knowledge on the health issues here, so I'm not asking for a political response, but from a health expert's perspective, is this a viable plan?
Okay, so as an infectious
terrible,
disease doctor,
I know, I ask terrible questions, but
as an infectious disease doctor with a lot of friends with school-age children, this is probably personally the question I get most often, like 10 times a day or so. And the truth is, there is no one right answer. The WHO set guidance at a 5% positivity rate to reinstate schools and other things. New York City's well below that at less than 3% right now. So, all of the community spread is as well contained as it possibly can be to try to reopen schools. At the same time, especially in New York City, we don't have large classrooms. It's going to be hard to socially distance. There's been a lot of concerns about ventilation and other things in the school systems, which are certainly valid concerns. But then again, weighed with the benefits of younger kids, especially going to school. When you're younger, a lot of school training is really dealing with others, learning how to communicate, learning how to work with others, more than it is reading, writing, and math. And so taking kids out of that environment is not good for them either, because you're trying to create an environment where they can learn the skills they need to move on to future grades, where it does focus more on book learning. I think, the trick is going to be putting students back into schools with aggressive testing plans in place, and knowing already in advance that schools are going to have to close for periods of time. This is going to be a start and stop process, and putting the things in place that we need to be able to start school, move to remote learning when we have to, and then move back is going to be what we're going to have to do. And that's going to be particularly challenging for parents, particularly households where both parents work, trying to manage having the child, at home and managing Zoom school while also doing your job. Or the unpredictability of school being open one day and closed the next is going to be a problem as well. There really is no good answer right now until we have a vaccine for this. And so the answer is going to be kind of preparing for all scenarios, but trying to get them back in school as much as we can and when we can. And so I think the outdoor schooling proposed today was a great idea to at least take advantage of that when we can, and prolong school as much as we can.
That was actually an extremely helpful response, and both informed and honest, and refreshing in this conversation about schooling. The same set of issues in terms of the conversation revolve around seniors, especially seniors in public housing. Delvette, what should seniors in public housing be doing now to deal with the impacts of COVID? We've heard, about the problems from Carlton and from Afia.
Thank you, Esther. That's a great question. And I think I'll start actually by summarizing some of the things that both Afia and Carlton mentioned already, because I think all of those domains really apply to seniors, which is, we often think that senior means you're retired, and that presumes that people have the economic stability to be retired, and that's often not true. And often it's even some of these senior people themselves are helping senior people, right? So a lot of nursing assistants and ancillary health workers themselves are seniors. So again, we have the guidance for safe practices in healthcare settings. As Jason mentioned, when as we learn, we do better and we practice it as systematically and as equitably as we can. But I think we also, even within sectors, have to ask ourselves, how are we doing for these different age bands? So when seniors have to work, how are they treated in service industries? How are they treated in healthcare? How are they treated in schooling? And we cannot leave it to the individual to negotiate their safety. You know, it's the responsibility of the organization to ensure that the people are safe. And I think in larger organizations, we often may have that mindset. Sometimes it needs to show up on the news, like the factories, for that to happen. But in smaller organizations, that's often not true. I can tell you again, using our experience here in Harlem, often you see senior people in the bodegas who work in the bodegas. You see senior people in service, or you see them, you know, even in CVS as, you know, as retirees, or, you know, trying to maintain, and are constantly needing to negotiate that someone who's interacting with them has prevention. So I think how we can help seniors, again, starts with our actions, because we can't immediately change necessarily the economic circumstance, but I think that, again, is another multi-level way of thinking about what we need to be doing. So does it involve additional economic stabilizing so that these people do not have to be in unsafe environments if they cannot mitigate risk, would be one example. Again, I think we've talked a lot about the neighborhood and community environment effects. Both Afia and Carlton talked about issues around building infrastructure and ensuring, again, that the housing community is a safe place for where seniors are residing. We also talked about the fact that many people, household size isn't just the number of people in the household, but that the household often involves multi-generational people. So you have grandma and grandchild, and probably even if grandma is home, but then you have maybe it's the middle-aged person who is the single working mother in the household who's going in and out, and that also involves mitigating risk. And then we have even you know, other things around healthcare, which I think is also important, whether that individual has a primary doctor. We haven't talked yet about mental health. I think, again, for those of us who are residing in this community, we're already seeing the disintegration and the commingling of the stress of this epidemic on accessing services or inability to access services. And the same is true for seniors. We know that as people age, mental health issues also present and manifest in a different way, and that influences even that individual's ability to navigate the space. So I think we need to think about how we can help at different levels, what can be done infrastructurally, immediately and in the foreseeable future. I think everyone also mentioned very well that there were lots of predisposing conditions that allowed this to happen, and those predisposing conditions are then exacerbated as a consequence of COVID. So, so that would be, I think, where we would think about how, in particular, do we address seniors in each of these spaces.
I really appreciate that response, being one of those seniors who are not retired. And it isn't quite that monolithic population like some people might think it is. Yet there is high risk that is related to age, and that was really very helpful. I have so many more questions I would want to ask you, but this is a town meeting and we've got some great questions from our participants. So I'm going to start with a question for the controller coming from our participants. Controller, when the pandemic started, NYCHA residents immediately felt the impact because our buildings stopped receiving regular cleanings. It was weeks before someone came to clean our spaces. What is the plan if another wave comes in the fall? Will we again lose services at NYCHA?
Well, you know, I love this question because it gets to the real heart of the NYCHA crisis, which is the pandemic didn't create the deficiencies in NYCHA, the politicians did. And when you think back to when NYCHA first was started, the first building in 1938, Mayor LaGuardia built NYCHA. It was aspirational housing. You got a NYCHA apartment back then, you were on your way to the middle class and beyond. And it was good housing, and it was housing with open space going from tenements to NYCHA developments. And then along the way, the federal government, the state government, the city started to divest in NYCHA, and we watched in horror as the buildings literally started to crumble. Since I've been controller, I've done 19 audits of NYCHA, which is a lot of audits. It's
19.
It's more than all of my predecessors combined in modern history. And in almost every level of NYCHA, you see roofs collapsing, debris, heartbreaking, dangerous playgrounds that the mayor can't even re-inspect. You have 55,000 backlog repairs. It's an average of 370 days to fix safety violations or asbestos. There's a lead poisoning scandal in NYCHA. The defective rate of boilers is 5 times the citywide average. So in answer to the question, will NYCHA be cleaned? Will NYCHA be better based on what we know about the pandemic? The answer is no. Until the mayor focuses fully on the 400,000 people and the buildings of NYCHA, we will continue to have NYCHA residents and those buildings treated as third-class citizens as if they don't count. And now we have a management structure that is just not sustainable between the chairman and the special master and Ben Carson and Bill de Blasio. It's a hot mess. And we've got to restructure a NYCHA recovery plan, the likes we've never seen, with all hands on deck, listening to FIA and the not-for-profits, listening to the tenant leaders, and then bringing all the people around the table for a sustained effort to fix NYCHA. But no, NYCHA's not going to be clean because government doesn't want to clean NYCHA. Government doesn't want to invest in NYCHA until the public stands up and says enough is enough. This is a civil rights issue, but it's also now a health issue, as COVID showed.
This is a really important response, Controller, and there are several questions from our participants around how to deal with problems that NYCHA residents are seeing. Fia, I'm wondering if you could chime in here in focusing on another version of this question, where one of our participants says NYCHA residents live in buildings that don't receive regular routine maintenance cleaning, as the previous participant said. Nor has the city taken initiative to clean specifically in high-risk shared spaces like mailbox areas and elevators. How can we address this? These are residents who want to know, how can they address this problem? What can they do? So from your perspective, Afia, what can residents do?
So I think there's a multitude of ways that we can step forward. And I would also say that this is an issue that, one, of course, the primary is for residents as living there, but it's also a jobs issue, to Delvette's point. And let me just unpack both. Listen, the comptroller is speaking just frankly with candor and all honesty, right? That people who live in public housing have been cast as third-class citizens where work is not happening even prior to the pandemic. So clearly I'm in a community-based organization, and we believe that power comes collectively, right? Either through a tenants association, as we have Mr. Carlton on here, or a community-based organization such as Community Voices Heard and so many others, where they come together collectively to both vocalize and make clear that action needs to happen to change things. But I'd say, to my initial point when I gave an opening, is at a moment where all New Yorkers, whether you live in public housing or not, have to understand that we have a responsibility in this fight, right? The landlord is the city of New York. That means all of us share a little of this on our hands, right? Non-willingly are part of this scheme and system. And, Delvette raised a really important point about, the city has a huge role to play here, not just as a landlord and currently functioning as a slumlord, but also as an employer. We've had the wonderful opportunity to build with a lot of the workers who work in public housing, unions like DC 37 and 1180. And a lot of the issues around getting cleaning happening in a real sanitary manner during COVID was the lack of PPEs that workers had to do the work, a lack of bleach, a lack of the materials that they needed. And so as a landlord and as a bad employer, right, where the city is holding properly to task other employers that were putting their workers in hazardous conditions, but are not following and abiding by their own rules.
Wow.
So we have a situation where particularly a lot of workers in public housing also either live in public housing or live in other types of subsidized housing, right? So they're not being treated well as workers. So the residents are not getting the services that they deserve as New Yorkers, as rent payers. And you have workers now who, a lot of them who are risking and going in because they either live there or have a deep affinity for the work that they do and believe that people have the right to live in sanitary, safe housing, are risking infecting themselves working without PPEs, working without the proper cleaning materials and going home. So I think we have an opportunity here where we have to really, push on this administration in the luckily ending days of his tenure here to say that, he started with the tale of two cities, and that tale is being written. And I'm gonna tell you, he don't look good in that book. Right? So how are we going to move forward to make sure that the city of New York and our name is no longer actively being a slumlord in one of the worst global pandemics that we've ever seen, and that they're being a high road employer to ensure that they're giving people the proper necessities they need so that they can execute their job properly and safely. So I think this is an opportunity for us to, jointly organize. I'm going to keep saying that, both with your religious institution, your political association, your block association, your tenant association, but it's not just a NYCHA issue, because 1 in 6 New Yorkers lives in NYCHA. They're your lunch lady, the crossing guard, the person at Duane Reade, your nursing assistant, right? Your school aide, civil service worker. So you're also coming in contact with your neighbors and your friends. So how are we going to tackle this collectively and have some collective courage to deal with this issue? And there's opportunity in the midst of this crisis to do so.
So Afia, thank you so much, because this is very important to get at. How do we get at together as a city and deal with these systemic issues that existed before COVID, but just have been made worse, essentially. And I think, what you say about organizing is critical here. That is clearly going to be one way in which to hold the city accountable. I want to go to Carlton on this, because there's yet another version of this question from our participants that's more personal in nature. And I think we want to also focus on what can somebody do right now? This individual says, a friend of mine lives in a NYCHA apartment and doesn't have hot water for weeks. I don't know how we expect people to stay safe if they don't have access to hot water to wash their hands with or bathe their children. So what can we do to make NYCHA accountable to deal with this immediate kinds of problems of not having hot water in an apartment during a pandemic?
Well, what we had done in Grand Houses, we had the previous management, they were removed.
Wow.
Simple as that. We fought they gotta go. The new management that we have, that I spoke highly of per conversation, we have a cleaner and healthier general Grand Houses. It's getting better. Our treasurer, Michelle Davis, has ignited a lot of the women, I mean, like hundreds, with the hand sanitizer. They spraying, wiping down, we sweeping our own floors. We're mopping in front of our doors. We're coexisting with our NYCHA management and workers. I think this needs to be fostered throughout the whole entire public housing. We need to get a day of cleaning, and to ignite the people to say, hey man, this is our home. Let's not wait on NYCHA. Let's work with NYCHA.
Right,
if I got a
right.
spillage on my floor, I'm not waiting for NYCHA to come. I'm going to clean it up. And that's what we're doing. If you walk through Grant is clean. It's clean. It's getting there. We just pushing to have the residents, not be a part of the problem. As far as trash and unsanitary hazardous conditions that some residents can do. we're fighting on it. Mine's is about solution. You know, everything else is beautiful, you know, to speak on, but we're looking straightforward. There's nothing clean cut about it. We coming head on. We've been doing it for it's going on 6 years now. When there was no heat and hot water here, we had the pipes, everything repaired. We had, I mean, this whole place was a wet house. We got on the ball. I contacted a few people. We had new kitchens. We had new cabinets and sinks, new bedroom wall fixed. We got to work here. We put some fire under the seats, you know, and we got the job done, but we got to do it entirely. Just can't be just one development. I could just say, hey, look, this is what we're doing. Let's all do it. Let's all try something that's working and get it going. We don't have a lot of time left. Leases will be running out in 30 years or so. Who knows what's going to happen after the lease? You know, we already got 50 plus years on the lease with X, Y, and Z to go. They got RAD programs and everything. You know, they trying to throw Section 8 on top of Section 9. And, you know, and so it's just problems coming all down the pipeline. But for as far as our health, yes.
What you're saying is so important because as a tenant association leader, you are helping people figure out both what they can do themselves, but how they can fight back, essentially getting management removed and a new management team in place, I'm sure made a huge difference. And then organizing within grant houses to get the tenants to also be part of the solution is is really an important thing. What you're saying, are you able to get young people involved in this as well?
Like I said, we have two teams out there. We have elders all the way down to 14 and 15-year-olds, and they doing deliveries. We doing wellness checks, and we distributing information along with the masks, hand sanitizer. We doing the whole plethora. There's nothing that we have left out, and people are actually catching on. You know, when they see us, we getting them thumbs up. You know, where we weren't getting them, now they see what you're doing. It's good to be seen, you know, but it's better that people know that you're doing something about the situation.
It's very powerful what you're saying. And, you know, I'm going to segue from this into another person who's also, it's about good to be seen, but also does. Because we have Barbara Askins here, and even though she's not a panelist, we sort of got a question for her. So I'm going to ask her the question anyway. And it's not surprising because it fits right into what you were talking about in your introduction about the important relationship between 125th Street Business Corridor and the health and well-being of the community, right? And one of our participants is asking whether or not the city is doing anything to help support street vendors and the small businesses. Are there programs available to them to help them recover? Because both the small businesses and the street vendors are both being hit hard for different reasons by COVID. So what's happening, Barbara?
So thank you so much for asking the question. And I wasn't prepared to put our proposal on the table, but I think this is a good time to do it.
I know, I didn't warn you because this was a question from our participants.
So one of the things that's happening since COVID is a lot of rules and regulations came out for how businesses are supposed to open up safe, but that didn't apply to street vendors on the street. And so also too, as it relates to small businesses, when the larger stores open up, they have more resources, so they were able to do construction and within their stores to be able to comply with the rules. But we know that a lot of our small businesses, they were barely hanging on. So to invest into their business to be in compliance with the rules was also very difficult. So we see, and our board have discussed it, that this open street policy is should go beyond just for restaurants. And so hopefully next week, we will be presenting a proposal to our elected officials that would allow open streets to apply to street vendors. But we're also looking at it for not from a perspective of street vendors. We're looking at it from the perspective of a small business market that would also allow street vendors. So it wouldn't be just for street vendors, it would be for small businesses. This is not asking for a new policy. It's just saying that there should be more uses other than for restaurants. And on 125th Street, it's really good for us because we don't really have restaurants. And so we're looking at the parking lane being a place where we can create social distancing spaces that allow street vendors to go in and do their wares, open up the sidewalks so that the sidewalks are clearer. So my next step, Controller, is to organize all of the elected officials behind this concept and proposal. And the date of my meeting coming to you guys is September 1st. So you will be receiving this. But I think it's a good opportunity, particularly for the Harlem community. I think the thing with street vending should not be looked at as a cookie cutter. The rules that's going through now does not allow neighborhood specific ideas to address the communities that we serve. And so we're looking at using that open street to see if we can create some of those opportunities that the questioner put forth.
Thanks, Barbara. And I think it's really important for everybody to understand, right, that the community doesn't stop at the edge of your apartment building or your NYCHA residence, that it is really the street and the street life and the small businesses that we have to deal with too. And they're being impacted. And that, of course, is impacting us in turn. There's a very specific question here, I think, that Delvette can help us answer about families living in NYCHA who really are cramped in to small spaces. And we talked about broken elevators, but these are apartments which we might call like high density, lots of people living in one apartment. How are we going to keep our children and families safe in these spaces where there's really overcrowding? It's another pre-existing condition for sure, but what can we do? And Delvette, can you reply to that?
Sure, I can begin to, and I think this
yes,
is.
And then we're going to move to Jason for the next piece.
Okay, and I may punt it to Jason because this was a question we had from the very inception of this epidemic coming to New York and coming to the U.S., which is I think it was almost very clear to many of us who do infectious disease work that the household environment, should a person be infected, it will invariably be a high density environment, even if you're two, and certainly when you're more than two, and certainly when, as we discussed before, when you have multi-generations in the household. And how does one actually function safely in that scenario so that you protect each other? And I think it always goes back to utilizing our best prevention practices that we have in terms of hygiene and sanitation and awareness. And we struggled with this because, as you mentioned, like if there are 5 people in a 700 square foot house and one person should suspect that they're infected, then how do you define even a quarantining space that is safe for that individual to protect the rest of the family? And I think it's something we need to learn as a community, to be honest. It would be folly for me to sit here and give you false answers about how does one navigate a tight household safely, beyond the things that we know that you should do always, which is that, active hygiene practices, if you believe you're sick, do your best to recluse yourself as much as you can, you know. So so wherever there is a space in the house that you can define, you know, that others will not access, so that you know, you don't all get sick, then you at least very well should do that. You should get tested. I mean, the things that we have now is that we have access to testing. New York City offers testing to everyone all the time. You know, we can improve on turnaround testing times, but we certainly, I think until you have a test result, a person should operate in the household like if they think they're infectious, they should operate as if they're infectious and protect the rest of the house. And that's the microenvironment. Hopefully Jason has more than I do, because I know this is a question that we've wrestled with, and we really wanted to learn more about how people have navigated this, because I think it's the natural human experiment where we will learn how people have done it well and share that best practice with others who are in the same scenario.
Well, I think actually that was really very helpful. And Jason, could you pick up on that? And I want to add yet another twist. We have a very sophisticated audience of participants here. And the other piece of the problem that was put out by one of our participants is has to do with flu season. And she asked, don't you think it will get confusing as to who might have the virus and who might have the flu? So not only would I like you to talk about navigating in crowded apartment spaces to follow up on what Delvette spoke to us about, but like, what are we supposed to do with the flu and coronavirus all coming at us at the same time this fall?
Yeah. I always get the easy questions, right?
Of course, you know me by now.
To follow up on Delavette's answer, I think, you know, one of the things we've been worried about from the beginning was the home environment. There was a lot of data that right after the lockdown in New York City started that most infections were coming from the home environment, from other people who either got infected or were essential workers getting infected and then bringing it home. I think it's really, really challenging in the home, and the less space you have, the more challenging it is. You know, if you're having symptoms of COVID-19, you want to try to isolate yourself as best you can. However, in many cases, especially if you live with other people, that's not necessarily possible. And so hand hygiene, mask wearing at home, sort of anything you can do to reduce that risk. If people can stay with family members or friends for that period of time, that's also potentially beneficial if you can do that. And then, as she said, testing is going to be really important. You know, with flu season coming up, obviously that's going to be a huge problem, because people are, you know, in the wintertime don't just get flu, but they also get other upper respiratory illnesses, all of which can look a lot like COVID-19. So again, testing is going to be crucial to separate out flu from other viruses. Getting your flu shot, even if you're someone who's never gotten your flu shot before, this is the year to do it. The more people we can vaccinate against flu, the less flu transmission we have in the community, the easier it will be to deal with what's going to be a very complicated flu season. And then if you have symptoms, get tested. You know, in other years, you may have said it's just the flu. I'll ride it out. This is the year to get tested, find out whether it's flu or coronavirus, so you can take the essential steps. And then, like Delvette said, is until you get your test result, act like you have it. Try to self-isolate as much as you can, in hand hygiene, mask wearing, anything you can do to reduce the risk of transmitting to others.
Can I ask a question, Esther?
Sure.
You can, yeah, go ahead, ask the question, Scott. I was just about to ask you a question,
Oh.
but go for it.
I just have something that's been on my mind about flu season.
Yeah.
Usually pre-COVID, you get a cold, you're not feeling well, you go to work almost always, you cough on people, you shake their hands, you don't think about protocol when it comes to getting the flu. I wonder, given all of these protocols and all of the steps we're taking, if we actually will have a very limited flu season because of all the precautions.
Oh.
And just to give somebody the glass half full, I don't think, although I'm not in your business, I can't imagine us having a tough flu season just based on all of our safety protocols.
Now that's an interesting question. Go ahead, Jason.
So that's the hope. They've actually seen Australia, which is on a different time course for flu than we are, has actually seen a definite decrease in their rates of flu vaccination with their protocols in place for COVID. And I think there's a chance we'll see less as well. But again, we still have children going to school. As we talked about before, children have been shown, while not shown necessarily to be a vector for COVID-19, are definitely a vector for influenza. And so there's still be stuff like that. I agree with you. I think that this year it'll be especially important that if you have symptoms, don't go to work that day. We need to make sure we have policies in place to support people when they are ill so that they don't go to work. Because again, we don't know what it is. As an ID doctor, I would have preferred you didn't go to work with the flu also, but it's never been more important than it is this year to make sure that people who are sick are not going to work.
That's an incredible silver lining. And we all have to remember that and tell our friends not to go to work if they're feeling sick. Controller, I have another question for you here from one of our participants. I work for an early learning program and we desperately need more workshops and webinars on health issues. Is there anything going on in the city that we could suggest to this participant that they might access as it relates to helping to educate her families and her staff in this early learning program?
Well, that's a great question, and maybe the time we have left, I have some folks online. Maybe we could take some names and get stuff to everybody, what the health department's doing, some of the work we're doing. On another topic, not health related, the Controller's Office sponsors what's called MWBE University, where we work with women and minority-owned businesses to access federal, state, and city help. And I'd love to get that out to you, Esther, because we've got thousands of businesses to go on our webinars, and I think that could be helpful. But I'll work to try to compile that list. And we do have a very powerful COVID brochure that speaks to a lot of these issues that we could certainly get to the participants tonight.
That's really helpful because I think that particularly for these kinds of locations, the mayor's office has really not made that information easily accessible. I have a question now. I just want to go through everybody to answer this question because this is something that nobody has any expertise in. So I feel like everybody should get to answer it. And our participant says, the following: it doesn't seem like many people in my community are taking the virus seriously. I see groups of teens walking around with only 50% of them wearing masks and many wearing them incorrectly. I'm a senior and I'm terrified of walking outside. What can we do to make sure that everyone is taking this seriously? So I want to start with Carlton, and then we'll move to Afia and go through the group.
Yes, how you doing? What we have done in Grant, we have, like I said, our treasurer, Michelle Davis. She's been igniting the fire. She's also my wife, which that's even better. We have Nico Ramos and a few other residents that are in the 30s and the 40s, Jerron Bryce, Sergeant at Arms. And what we do, we send them out to go tap into the youth. We come out there with like about 100 masks. They're not on the line to receive any food distribution. So we just go right to them. Give them hand sanitizer. Yo, if you eat a sandwich, you have something to clean your hands with. Put your mask on. Your homie might, have a cold. We just put the information out there, straight, clean, and clean. No hold back, no big talk. We just tell them point blank. People's lives are on the line. And my team, they just do it. And it's real shortcut. No big talk about it. And the youth is responding. And that's a beautiful thing. We got youth around here that the kids and all of them, everybody got masks to walk around and be out in the yard. They like to do workouts and stuff. We send them, masks and any kind of things they need to wash down or shower down the workout bars and stuff. Also, we try to get NYCHA to expand their TPA. That's the tenant participation activity. We can get some of these kids involved in social distance classes and help them clean up the neighborhood also. Learn about, stepping up to a higher etiquette, in the hygiene pool. Because right now, we do have people who, as stated, previous, not to be redundant, they're not coming up to where we're at. And where we at is trying to have every resident, all 1,940 apartments, in compliance with some form, actually not even a form, a high level of cleanliness, and it starts in the home. People got to understand, NYCHA accumulate a lot of dust. So we are working with a team called NOAA, and we get information on air quality. We got to clean our homes and then expand outward to where we out in the streets and give that respect that Delavet and Afua and them were talking about.
This is very important. I'm glad we're taping this today, because this could create a template for other housing authority leaders of what they should be doing. Afia, could you comment on this as well?
Sure. So I'll say I definitely take the participants' point that it is frustrating and extremely scary to see people who don't properly wear their mask and maybe adhere to rules. I'll give a slight twist on this, as I started in our conversation with just some very hard facts to deal with, that I'll say that I think New Yorkers have overwhelmingly met the call, right? We know we have these structural inequalities that no one of us put together, and sadly we're still living through them and trying to deal. But I will say, as individuals, particularly those New Yorkers who didn't have the privilege to be able to leave for different times, who saw up close and personal losing their loved ones, their neighbors, their fellow church congregants, teachers, people they love to this virus, I think most New Yorkers take this pretty seriously. And I'm not trying to excuse anyone, because when I'm in the grocery store and someone's too close, I'm like, back up. But I will say that I have been moved by how folks have had to change on a dime. I started saying that I'm a parent of school-age kids. And my 20-month-old, whenever we get in the house, gets ready for her hand sanitizer and is doing her little thing. So I've seen New Yorkers change our entire understanding of life. What is it to be a New Yorker than to run up on somebody, give them a hug when they're coming home, or a high five? And we've, to a large degree, stopped that, to put on masks, right? And have to try and figure things out, and while still lending assistance in the midst of the, at times, failure of government. So I think that we've made some amazing strides. And one thing we didn't fully get a chance to discuss that Delavet raised is the mental health toll that all of this takes, right? Being inside as an adult, as the leader of an organization with the staff, right? Trying to figure out, while I appreciate this Zoom platform, I'm so excited for a multitude of reasons when we're past Corona, so I could never be on a Zoom again. But, folks have had to try and connect in ways that aren't fully allowing the human spirit to come. So I think sometimes what we see is not folks not understanding and heeding the importance of following this, but at times folks just feeling overwhelmed and trying to connect in ways that may not be the best. I think that today when I was on the playground with my oldest, trying to police 7-year-olds to not hug and remember to put on your mask, even when you're in the sprinkler, I think that, human nature wants us to be near someone. And even though we've largely conformed in a way that I didn't think was possible, we still have a long way to go. So I take the participants' point, but I would love to end on the high note of that we have done so much in such a short amount of time, with so much chicanery at the federal level of government. And I think we'll continue to do it because we're New Yorkers. And that's
this is very, very inspirational. And I think you are completely right. And I want to give an opportunity to Delavet and then to Jason. And then I have a final question for the controller.
Okay, great. Thank you. I'll be brief. I think both Afia, Carlton have already made really good points on this, which is it is hard to change behaviors. For even those of us who straddle this world of biological and behavior, I've learned in health programming that people will always tell you what you want to hear. And they just won't do it. So it is impressive, but I think we can do a little more. You know, again, thinking about even just how behaviors are changed and messaging, and just trying to even figure out how to get messages to people who are still resistant. Because we do have that, and we do understand that the mass effect works, right? You know, the more people who are, the more people who are, the more people who are here.
Oh my, another cutie.
I was also bribing with PB&Gs and Pirates booty, but
Mommy, can I have drink water from your water bottle?
yes. So anyway, I think that's my cue to wrap up.
Okay.
We can do more in terms of communication. The end.
All right, Jason.
I think I agree with all the panelists so far. I mean, New York has done a great job. It's really a harm reduction approach more than anything else. Just like anything else we do in healthcare and medicine, everyone is not going to be able to do it all of the time. So providing proper messaging about trying to do it as much as possible. If you wear your mask for 75% of the day, that's 75% of the day is better than nothing. You know, some people are more uncomfortable than others. Some people are outside for long periods of time. You know, if everyone does the best that they can, that's what's going to end the epidemic until we have a vaccine and get everything going. So I think, you know, everyone's done a really great job so far, and we need to keep it up through whatever's next.
Thank you. So I have a final question here for the controller before we completely wrap up what's been an amazing evening. So, you know, we've talked about so many things this evening, controller, and you know, I think Afia sort of set us on the right path of being optimistic in the face of so many challenges right now. One of the last questions that our participants asked us, and I just thought this would be something for you to address for us, was really about how what we've learned from this pandemic might help us inform government's response to social support services needs. Do you think we're poised now to do a better job, essentially? They use the example of Europe, although I don't know that I want to go there. But do you think we're poised to just do a better job in actually understanding what people need and having government deliver on it in a way that's more effective than we've been, frankly, in the past?
Well, you know, I think what Fia said is very inspiring, because you can be a critic, but when you see the human experience in such a positive way, then we do have to give credit to all New Yorkers, and it is important to do that, and I'm glad she did. I said, you know, my mom died of COVID on April 3rd at the height of the pandemic, and I couldn't visit her in the hospital. And she was older, obviously, with pre-existing conditions. And I was talking to her doctor who was in the Bronx hospital she was at. And I said, look, I guess a lot of people are losing their parents and grandparents. And the doctor said to me, you know, not in the Bronx. In the Bronx, we're losing all people. We're losing 40 and 50-year-olds to type 2 diabetes because of type 2 diabetes, pre-existing condition, hypertension, cancer, the things that we always see in terms of siting of these big facilities and bus depot stations. And it really speaks to how government has to change post-pandemic, because we've allowed people to manage their illnesses. And we never really invested in solving some of these issues, whether it was land use decisions, public policy, environmental decisions. And we just let the poorest people manage. And COVID came in and said, no, I'm a disease that goes after the most vulnerable. I discriminate. I go after Black and brown communities. I go after people who have suffered with managed conditions. And I think this is a moment for government to own up to the fact that a lot of this has to change, and that we can no longer close our eyes to communities that have been hit hard environmentally, hit hard in terms of health conditions. And maybe this is the one moment we have in our lifetime as we reimagine the city we finally go and do something about it. And that is something I wish we had done decades ago, but we can no longer ignore the obvious that poorer people from certain neighborhoods die because things are not equal in the city. And I think we should really create programs and do it for real, not just speechify, not just talk about it, but use the powers of government to make change, work with not-for-profit organizations, work with AFIA and others, work with the medical profession, and just do this finally. And if we do that, then we'll say to our kids when they ask, what did you do when the fight happened? And you'll be able to say, you know, your dad or your mom, we were in the fight. We made things better for the city. And if we do that, we'll all be better for it.
Thank you, Controller. I can't think of a better note on which to end our panel discussion tonight. Each and every one of you made an incredible contribution to this conversation. I'm so glad we're not just live streaming, but that we're being taped as well, because I know many, many more people will want to listen to this conversation. I want to thank Afia and Jason, Delavet, Carlton, and Barbara, and then also Nina Saxon from the Controller's office, and Andrea from my office, and Trisha from Community Affairs at Columbia, and Bashar, who made all the technical magic happen on our virtual town meeting. And I want to tell everybody to remember that you can find all the resources online at neighbors.columbia.edu/who's at risk. Please, everybody, stay safe and stay well. Keep taking care of yourself, your family, your community, and the entire city of New York. Have a good night.
Thank you, Esther.
Thank you. Thank you. Thank you, everyone.